Hi everyone and welcome back to the Hair Loss Show. In this episode we're going to talk about oral finasteride and specifically the dosing of it and the time frame of taking the medication. So stick around.
Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everyone, welcome back to the show. Thanks again for watching and please remember to like and subscribe to the channel. Today's episode is based on a question that we had in one of the comments section. So thank you for this person who wrote this comment. This is not the first time we've had this question. Quite a few of you have talked about this, so I thought we'd address that, which is the dose of finasteride. Now, we've talked about in the past microdosing or customizing the dose of finasteride, and generally speaking, in our practice, both with Dr. Knudsen and myself, we generally use 1 milligram 3 times a week. So that's essentially 3 milligrams per week. And we would split it sort of Monday, Wednesday, Friday with 1 milligram, 1 milligram, and 1 milligram. But the question was, is that the best way to take it? Or can you take 0.5 milligrams daily on each of the individual days? So you're essentially getting the similar sort of dose, but you're taking it on a daily basis. Does that keep that DHT levels under control better than you would if you're just taking it on alternate days? And I think the answer is you can take it whichever way you want. I do not think there is a significant difference or benefit in one way or the other. Certainly in Australia, the 1 milligram tablet is commercially available. It's easily available on prescription. And so that's a lot easier to take. Just take one tablet on Monday, Wednesday, Friday. With the 0.5 milligram, you either have to cut that tablet into half, or you have to get it customized or specifically compounded for you as a 0.5 milligram capsule, and take one of those a day. There's logistics and cost associated with that, but in essence it does not change the outcome. And the reason is that there is a difference between the effect of finasteride and the half-life of finasteride in the system. Half-life is a chemical term that is used to measure what the level of finasteride in our bloodstream is after having taken it. And so the half-life of finasteride is about 8 hours. What that means is that if you follow that rule, then we should be taking the finasteride 3 times a day, because there are 24 hours in a day. If the half-life is 8 hours, then you should be taking it 3 times to keep those serum levels at their peak. And that would be true for something like an antibiotic, which you want to be able to have its effect and get on top of the bacterial infection. This is not the same with finasteride, because what finasteride is doing is it's blocking an enzyme. So we know that testosterone gets converted into dihydrotestosterone, and there's an enzyme called the 5-alpha reductase enzyme that does that. Now your finasteride, what it does is it's blocking that enzyme. Now that enzyme essentially will be blocked for about 3 weeks. So you don't want to bring those DHT levels down to 0. You just want to block a certain number of these enzymes consistently, just to keep the levels below that threshold of what we want to stop the miniaturization. So the timing is largely irrelevant, whether or not you take it daily or you take it 3 times a day. The effect is just to keep a certain number of those 5-alpha reductase enzymes ineffective, and therefore lowering that level of DHT in the system. So either way is perfectly fine. It's what you're more comfortable with. Some people just like the concept of Monday, Wednesday, Friday. Some people go, you know what, if I don't take it on certain days, then I won't be taking it regularly. I like having a rhythm and a routine, so I want to take something on a day-to-day basis. Either way is fine. All right, I hope you found that useful. Thanks again for watching, and we'll see you on the next episode.